Continuing my journey, I next visited Anvesana, which is Vyasa's Advanced Research Center in Integrative Medicine. I met Dr. N.K. Manjunath, who is the director of Anvesana, who shared with us his journey for last 30 years at Anvesana and all the research areas and focus that they have at Divyasa.
Um, Thank you for agreeing to speak to Digital Wellness. Dr. Manjunath, it is amazing to hear your story, and you are there for 3 decades with Anvesana. I wanted to ask you, how was this entire journey for the last 3 decades?
See, the journey has been wonderful because always we never anticipate and never assume that when I take my first job, I am going to continue for such a long period. Many people ask me this question: what made you to stay in a place for
Right.
3 long decades?
Yes.
So my answer is very simple, that it actually has gone like 3 days for me.
Wow.
Because probably I give complete credit to the organization and the guiding spirit, Dr. Nagendra ji, Dr. Nagaratna and others. And number 3, research, which has kept me so engrossed in this place. The place where you are sitting is called Anvesana Research Laboratories. This we started with a very small one room in this building, which is a 3-floored building. And from there, today we have such research facilities which probably you may not find anywhere under one roof in the world. So the whole intention was really to bring whatever you can understand about an individual and his health, and even during disease, we should study in one laboratory. And that's what has been created over here. It has been a wonderful experience, both challenging as well as rewarding, for a simple reason that yoga research has always been looked upon like something which we should not actually go too much into the depth, because when great yoga masters come to my laboratory, I always ask them only one question, that can you give me an opportunity to experiment on you? Okay, so when I tell that, nicely, very senior people, they pat on my back and tell me that, oh dear, yoga is to be experienced, not to be experimented.
Right.
So right from such questions being asked to where we are today, this laboratory and this institution holds little more than 15% of world literature on yoga today.
Wow.
One university in India has got little more than 650 publications, when the whole world has seen around 5,900 publications, out of which 650 comes from one institution. We feel very proud about it. At the same time, it also opens up lots of questions to us. The more and more research we started doing, more and more questions started emerging, which makes us feel that probably the whole journey the future journey has to be much more organized than what we have done earlier. It is not just looking at equipments and doing some measurements in the body, but also how do you interpret them? Okay, because in conventional research, if you want to really publish in a very good journal, you need to do something called a randomized control trial.
Right.
Okay, so we have been talking about yoga is something different. You cannot bring yoga to this kind of a research where you do randomized control trials. But if you really want to be publishing in such high impact journals, you need to do research of the same nature. And For us, the landmark created in 1985 by Dr. Nagendra ji and Nagaratna ji, publishing the first ever research paper of this organization in British Medical Journal. So that's the kind of standard set by the founders of this organization. And we also have such a good clarity to say that research has to be actually reaching a common man.
Right.
So then we bring our basic research to applied research and make it translational research. So as we started doing all this, I never got to know that 30 years have passed.
Wow.
So that's in a way the simplest way to say that I've been enjoying my time at Vyasa or Vyasa, which is the mother organization, and we are looking very positively to contributing more and more.
Right. You know, I have come across very few people, even after working for 3 decades in the same organization, seem to be so cheerful and so much looking forward for what to do next. I think this is a big takeaway for me from talking to you, Dr. Manjunath. It's really amazing to see somebody with so much of dedication, I would say this, right? Dedication, and really want to do more and more of this. I think that speaks a lot about this organization. So how do you conduct experiments here? And related to that question again, because you mentioned about research in yoga, because I understand that you are focused a lot on holistic well-being. It is even yoga and parts of a lot of other things put together from a holistic health and wellness standpoint. So are you restricted only to yoga research, or do you actually cover a broad base of research beyond yoga? And how do you conduct experiments? It's a loaded question, but I thought let me ask them both together.
Perfect. I mean, see, as you enter this laboratory, you see our board, a center for integrative medicine research.
Right.
Okay, so the whole focus is not just on yoga. Yoga is certainly, probably we can take it as the base on which we bring all other systems of medicine. We talk about lifestyle, we talk about bringing a change in your stress and well-being. For everything, yoga makes a base. So that's why we call it as yoga-based integrative medicine.
Okay.
So the research is actually focused into multiple areas, not only limited to yoga. As you can see in this facility, we have a psychophysiology laboratory which caters to like autonomic function testing, by which we understand all involuntary functions. It caters to exercise physiology, it caters to it also caters to sleep medicine. So a lot of basic research goes in this laboratory to understand what exactly happens, be it an yoga based intervention, be it an Ayurveda based intervention or a naturopathy medicine based intervention. What happens to your body, what happens at a physiological level. We understand that before we design specific modules or specific treatment protocols to manage diseases. Then once we do that, then we use it in application. So what supports us is, like psychophysiology, we have a cognitive neuroscience laboratory.
Right.
So the cognitive neuroscience lab definitely gives a lot of information, particularly in relation to yoga.
Right.
Everybody wants to know, when I sit and do meditation, which part of the brain is active,
Right.
and where exactly is that light which is switching on when I have reached my
Right.
such emancipated situation or state. But finally, what we have understood through so many studies, including functional MRI studies, imaging studies, etc., that there are specific areas which are active during meditation. But more than that, meditation does switching off mechanism, inhibition, what we talk about. Like, it knows what information to allow beyond your brainstem, and then only you can focus on your meditative practice
Right.
So then we also have such a wonderful molecular bioscience lab, and we have a psychology lab, and we also have an exploratory bioenergy lab. So all these labs collectively are used for basic research and then for clinical research. Like we have close to a 400 bed facility. We won't call it as an hospital.
Right.
We call it as an Arogyadhama, where also we don't call patients, we call them as participants. When people come, so we test them before and after a yoga intervention, an Ayurveda intervention, and naturopathy intervention, or a holistic, like we bring all of them together to call it as an integrative package. We also use yoga and other studies here for its application into rehabilitation. So you find lots of publications here looking into how, be it neurological rehabilitation, it can be multiple sclerosis, stroke to Parkinson's and Alzheimer's. So there are publications. We collaborate with international centers. Like there's a wonderful center in Germany where our students will be deputed to that center for training in rehabilitation. So there are lots of publication in this field. And cardiac rehabilitation, we work with Narayan Hrudayalaya here for bringing holistic wellness into cardiac rehabilitation.
Wow.
Patients, before going to coronary bypass grafting, we give them a kind of an anxiety reducing yoga protocol, prepare them, and after the surgery, then once again they go through yoga therapy, and we have followed up patients for a little more than 10 years. So that's an amazing study which has gone into cardiac rehab. Similarly, psychiatric rehab. So we work with National Institute of Mental Health and Neurosciences in Bangalore. Schizophrenia is one condition, anxiety disorders, depression, etc. Such studies were conducted and publications suggesting that you have an amazing benefit you can derive like that. So you said it right that the future is into holistic well-being.
Yes.
And evidence, whatever has been prepared so far and published, also gives wonderful direction to us, saying that probably when you integrate couple of therapies,
Right.
the kind of benefits what you can get, you can augment them or you can multiply them, and the patients can get better relief and the clinical outcomes can be much better.
You know, I have so many questions, and I know I can spend days at this place. You know, so positive and so beautiful. But you know, I now kind of understood one thing. You know, when I went to Arogyadhama just before coming here, Dr. Manjunath, I did see a session in action. So, you know, I just asked, they said they are participants. To me, participant is, you know, like I do yoga every day. I go to a yoga class. So I'm like a participant. I said, no, it's not a participant. I want to know who are the patients. They said, no, they are participants. Now I understand why they call them participants, because I know you refer to, you know, even people who are undergoing therapy as participants. At least I'm glad I got that clarity and kind of understood, you know, a little understood a bit. I know this is too vast for me to even understand, but understood a bit on what you exactly do at Arogyadhama. Dr. Manjunath, thank you for this beautiful, you know, words that you said. I know your 30 years long journey cannot be summed up in the, you know, 10-15 minutes, but I really enjoyed this conversation, and I hope to have some more from your side. Thank you very much.
Thank you very much for in fact giving me an opportunity, because whatever happens in institutions like this, it has to reach people.
Absolutely.
Okay, because I believe very strongly that research is of no use if it's not reaching a common man.
Absolutely.
And you people are doing this job.
Yes.
Many congratulations for this. And whatever has been an amazing journey of yoga for a little more than 5,000 years.
Right.
And the institution has been created by such amazing people like Dr. Nagendra ji and Dr. Nagaratna. And we are all just instruments in taking that vision a little forward.
Right.
And I have such a dedicated team here. If anything we have to certainly give credit, it goes to the team, such amazing researchers working with us, and for people like you all who are reaching it to the world. And many congratulations, and thanks for joining hands in making this whole journey of holistic wellness reach people in a very positive way.
Thank you, Dr. Manjunath. I'm really looking forward for doing a lot of exciting things together. Thank you very much.
Continuing my visit at Anvesana, I met a lot of researchers and visited each of the labs at Anvesana. I was amazed by the kind of work and the research that was being done at Anvesana. I will be covering that in my next episode in part 4. Stay tuned, like and subscribe to my channel Digital Well.